I am Dr. Jagadeesh Kanukuntla, MD Internal Medicine, practicing as an internal medicine specialist in Apollo Spectra Hospitals, Kondapur, Hyderabad. Today I would like to discuss on how to treat high-grade fevers. Fever is a day-to-day problem that we face in our clinic. Many people come with fevers, but again we see that many people don't come early with fevers. They come at the end, they develop complications. So there are various causes of fevers. Can be bacterial infections, viral infections, fungal infections. The causes of high-grade fevers can be malaria, typhoid, dengue, swine flu and many other infections. So whenever there is a fever, try not to treat on your own, try not to take self-medication, try not to take medications from a pharmacist who is not a registered practitioner. Try to come to a qualified specialist like us, because there are various causes of fevers which have to be identified based upon the history, examination and appropriate investigations. Depending upon that, we would like to come to a conclusion and give the appropriate antibiotic, antiviral, antiparasitic and antifungal drugs which can heal your high fevers and prevent you developing any complications which can affect your brain, heart, lungs, kidneys and which may cause death. So I request you to take our services, get cured from your high-grade fevers and try not to be a self-doctor. Thank you. I am Dr. Jagadeesh Kanukuntla, MD Internal Medicine, practicing as an internal medicine specialist in Apollo Spectra Hospitals, Kondapur, Hyderabad. Today I want to discuss on when to use antibiotics. Now, antibiotics is a common topic. It is most commonly used, and my patients, they come to my clinic with history of fever, with already usage of antibiotics and ask me when to take antibiotics. So my main goal to talk on this point is we need to prevent indiscriminate use of antibiotics, because antibiotics are life-saving drugs and indiscriminate use of antibiotics causes resistance against these antibiotics, and if all are resistant, tomorrow we be left over with no antibiotics to prevent these dreadful infections. So whenever you come across with fevers and any other infections, it is most important for you to come to us, give the history and we assess whether you need antibiotics or not. It's not every fever is needing an antibiotics, because there are various causes of fevers. It can be parasitic infections, it can be viral infections, it can be fungal infections which doesn't need usage of antibiotics. Antibiotics are useful only against the bacterial infections. Based upon the history and the investigations that we do, we come to a conclusion and then only we have to give the appropriate antibiotic as against the appropriate bacterial infection. So this is most important to prevent the antibiotic resistance and give you the appropriate dose of the antibiotic so that the illness is cured without any complications. Thank you. I am Dr. Jagadeesh Kanukuntla, MD Internal Medicine, practicing as internal medicine specialist in Apollo Spectra Hospitals, Kondapur, Hyderabad. Today I want to discuss regarding thyroid disorders. Thyroid gland, which is present in our neck, is a very important gland of our body. It acts as an ignition to our engine. Without thyroid gland, our hormones, this body will be very weak. Thyroid disorders mainly are of two types: low performing thyroid and high performing thyroid. Low performing thyroid is called as hypothyroidism, high performing thyroid is called as hyperthyroidism. In low, most common is hypothyroidism, in which the thyroid hormone production from the thyroid gland is very less. Because of that, there are more chances of developing obesity, increasing weight, weakness, fatigue, swelling of our limbs, loss of hair, irregular menstrual cycles and decreased energy. This most of the people are unaware and they will not treated properly. And hyperthyroidism is a condition where the thyroid hormone is more, because of which there will be fast heart rate, prominent eyes, weight loss, excess heat in the body, and this affects heart, brain, etc. These two disorders of thyroid are very important, that has to be controlled so that our body is balanced and every activity is done regularly. Thank you. I am Dr. Jagadeesh Kanukuntla, MD Internal Medicine, working as an internal medicine specialist in Apollo Spectra Hospitals, Kondapur, Hyderabad. We want to discuss today on flu and cold. So cold is most common thing. Most people will be affected during the winter seasons, and few of them are also seen during the summer seasons. It is a most common thing which is an infection of the upper respiratory tract, where most of them present to us as a running nose, stuffy nose, blocked nose, headache, throat pain, cough, can be dry, and associated with joint pains, muscle pains, and severe weakness. So this cold can be because of any bacterial infections, viral infections, and most of the times can be because of the allergic. So it is very important to differentiate between all these things, and most common cause of viral cold is flu. And flu, the various types of flu are present, can be transmitted through birds, can be transmitted through pigs. Those which are transmitted through birds are avian flu, transmitted through pigs, and most rampant all over the world including India is the swine flu. And swine flu, the variant is H1N1. It is very dreadful virus which affects our body. It commonly affects those whose immunity is very less, like in pregnant women, any immunosuppressed people, young pediatric people, and old age. So these people have tendency to affect their blood vessels, which causes low BP, it affects the lungs, causes respiratory tract infections, breathlessness, and that is a cause of that is leading to death. So identifying cold in the early stages is very important. Approaching to us is very important because we will differentiate this between a common cold and the swine flu and other various types of flu, and give you appropriate management as per your symptoms.